Sometimes the tooth just needs to have a root canal in order to be properly restored. There's so much of the tooth missing. The restorative dentist needs to put a post in or anchor something into the root so they can restore the tooth, and that requires a root canal. Yeah, first off, root canals should not hurt. There are a few that are so inflamed and sore. All the horror stories come from a very, very small group, way less than 1%. Most root canals are just boring. If you can do a filling, you can handle a filling, you can handle a root canal. You're numbed up, you don't feel a thing. We make a little hole in the biting surface of the tooth, very small, it's about 3 or 4 millimeters in diameter, and that allows us to go in and expose the pulp tissue, the inner tissues of the tooth, where the nerves, blood vessels, lymphatics, connective tissues are. And then we have other instruments that go through and negotiate right to the root tip, and we remove all of that organic, all of that soft tissue from inside the tooth. Then we disinfect it, and then we pack it with a filling right down to the root tip so that it can't reinfect. That's a root canal. It's getting rid of the diseased, inflamed, necrotic, whatever the tissue is inside the tooth. It is removed in its entirety and sealed up.